Good morning. My name is Jerry DiColo, and I'm the Metro Editor of the Times-Picayune. Welcome, and thank you for joining us today for a panel on COVID-19 and Carnival. Our panel of expert sources will discuss what stage of the pandemic we're in, how to make decisions to keep safe during Mardi Gras, and what we can expect from our healthcare system during this busy time. But first, we'd like to thank our sponsor, AARP, and here is a short video message from them.
Since the beginning of the coronavirus pandemic, AARP Louisiana has consistently provided important information and resources to help you and your families through these challenging times. Good morning, I'm Bobby Savoy, AARP Louisiana Volunteer State President. We're pleased to announce that we are partnering with The Advocate, Times-Picayune to bring you important forums with experts all year long. It's our commitment to you to help you stay informed throughout the year on an engaging platform. Today's conversation is a very important one as we discuss how you can protect yourself and your loved ones this Mardi Gras season. Although our COVID numbers are decreasing, it is still critically important that we remain vigilant and follow the advice of medical experts and our physician. AARP is also urging all eligible Americans to get the vaccine as well as the booster shot to ensure you stay safe. If you'd like more information about AARP Louisiana, please visit us on Facebook or at aarp.org/LA.
Now I'd like to introduce our health reporter, Emily Woodruff, who will be leading today's discussion. Emily?
Thanks, Jerry. So we're entering into the thick of a carnival season that is really going to be unlike any other. It's been 2 years since we or really any city has gathered in this way. And we're trying to balance COVID concerns and a shortage of healthcare employees and emergency response officials with this need that we all have to return to traditions and celebrations. We want to do it in a safe way, but we also want to let people know what the risks are so they can make the best decision for themselves and the other people around them. So to help us navigate this, we've assembled a panel of 3 experts. Today we have Dr. Tekeda Ferguson, an epidemiologist at LSU Health Sciences Center School of Public Health, Dr. Stephen Hales, a pediatrician, founder of Hales Pediatrics and chair of the board of Children's Hospital, and Dr. Julio Figueroa, Section Chief of Infectious Diseases at LSU Health Sciences Center School of Medicine. Thank you all so much for being here. I feel like I benefit from talking to you all the time, and I'm really glad that I can share that today with other people. So I want to start by telling everyone what it is you all do and what your role has been during the pandemic. So Dr. Ferguson, let's start with you.
Sure. I'm an associate professor and chair of the epidemiology program here at LSU Health Science Center here in New Orleans. I also hold a secondary appointment in the School of Medicine, Department of Physiology. I'm what we consider or call a chronic disease epidemiologist. In that I focus on thinking about what are the causes, understand the causes of disease and the distribution of different diseases in our population. As the epidemiologist, we want to understand these things to help us better protect the public and improve the health of everyone in our society. So during the pandemic, I have been working with our other faculty members and different colleagues, MDs, additional epidemiologists within the state and across the country, looking at rates, looking at who's at risk. As we think about, and we learn kind of through this all, understanding what things we should be aware of, how we should operate in this space, and how we can remain safe. But thinking about vaccinations, vaccines, all of these things have come together and been an area of epidemiology. You've heard this word a lot during the pandemic. And of course, we're here to help educate the public and improve the health of the public overall.
Great. Well, thank you for being here. Dr. Hales, tell us about who you are and what you do and what you've been doing during this pandemic.
Thank you, Emily. Lovely to join Dr. Ferguson, Dr. Figueroa to talk about this today. I've practiced pediatrics in New Orleans for over 40 years. Have been on Children's Hospitals Board for nearly that long and chairing the board now. Also a founding board member of LCMC Health. So my perspective on the events of the pandemic over the last couple of years have been very much both listening to families, but also from a healthcare system perspective, watching the really heroic work of our doctors, our nurses, our staff through the initial phases of the pandemic and still the enormous challenges, and the way they respond to that is inspiring to me. So that perspective, along with listening to families that have 15 grandchildren now, and they all love Carnival. So as this season approaches, lots of questions, and hopefully we'll have good answers. I guess the other hat I wear going into the Carnival season is a Rex hat. I'm the Rex historian. We're celebrating our 150th anniversary this year. So we've been working to put a beautiful parade together and plan a ball, all watching carefully the realities that surround us. You can never do those things in isolation, and that's part of what we'll be talking about today. But there's a pent-up demand for this celebration. We're looking forward to staging a beautiful parade, but we are also cognizant of the realities that we're talking about today. Thank you.
Great. Thanks so much for being here. Dr. Figueroa, let's go to you.
Sure. So I'm the Division Director of Infectious Diseases at LSU Health. So in that role, I've been involved with both LSU's response on campus here in the Health Sciences Center, as well as the response in the hospitals that we're affiliated with. So as a clinician, seeing patients and developing clinical protocols with my colleagues who are taking care of those patients, as well as trying to keep our population both in the hospitals as well as on campus as safe as possible. So those have been my roles in this.
Great. And we've talked many times during this pandemic, so I always appreciate your guidance. So first, I want to get into where we are right now as far as, is this a good time to have Mardi Gras? We're getting into the parades this weekend, some of the bigger parades, and Mardi Gras itself is on March 1st. So Dr. Ferguson, as we're coming off Omicron, is this a safe time to celebrate? How do you evaluate risk right now, considering where our COVID numbers are, and also that, people are going to be traveling in maybe from other places where COVID numbers might be different? How do you evaluate that risk?
Right. It's difficult, right? And in terms of you've heard the conversations for us in terms of our city health officials from the health department, as we know that these decisions are not made in isolation. Our mayor, the governor, working with different task force, their weekly task force meetings at the city level and at the state level, evaluating the data that we have that are coming in. Of course, we know the importance of Carnival for us and for the city, but the reality is that we are still in the middle of a pandemic. That this is definitely a sense for us that do the work for communities, mothers, children. I'm a mother of two, and understand I'm an African-American mother, a person of color. We've heard how that there's been differences in terms of distributions of illnesses and diseases across different communities. But we know that we love Carnival in terms of this area and the different things it can do for our community. So we've been, of course, tasked with trying to provide an environment that can provide us the safest kind of Carnival that we can have in a pandemic. But of course, we are still at an alert and at an alarm in terms of, is this a safe time to have it? Thankfully, right, that we have seen a decrease in rates for the state and in the city. So that is a good thing. But of course, we have to continue to be very vigilant in what we're doing in terms of practicing, in terms of, continue to get those people that are not vaccinated and not boosted, that we continuously want to see those numbers rise and increase those vaccination numbers. The thing, Emily, that you mentioned is that, yes, within New Orleans Parish, the numbers for vaccination rate are a certain area or level, but thinking about other parishes, people that travel into our city, is going to have a very big impact on our numbers and on our rates. and what we might see after Carnival. So I'm sure we're going to get into talking about more of things that we can do to try to remain safe. But of course, our biggest defense is thinking about a vaccine and boostering, of course, our mask and some of the mandates that we have in place in the city. So I'll stop there and we can definitely talk a little more. But in terms of, we're still in a pandemic, but of course we have been doing better and our rates are going down. So that is a good thing for us now.
And there seems to be this approach to an individualized risk right now, right? Like we're hearing about, states dropping their mask mandate. And what I'm hearing from experts is that everyone should think about their decisions in the context of their own risk. So how do you balance that in a time like Mardi Gras, when you might be, around immunocompromised people or, people who are at more of a risk? What is the decision-making process right now? Dr. Figueroa, do you have any thoughts on that as far as what people's duties are to themselves and to other people?
So first duty to self is, as Dr. Ferguson was mentioning, trying to maximize your protection against the virus. So boosting, we talked a while back about this is the perfect time for a booster shot, right as things are going down, getting ready for Mardi Gras, because that's when your immunity is going to be at the highest. So if you haven't done that, it's time to do that. And that's protecting yourself as well as protecting other individuals. The other situation is to look at the people around you, the people that you interact with, and what are their risks. So if you have immunocompromised individuals who could potentially have severe disease, that's certainly something to take into consideration in terms of your calculation. And that would also include individuals who can't get vaccinated. So individuals who either couldn't get vaccinated because of some issue with vaccination, or the ones that are 5 and under are another group to consider. The third is sort of transmission across the community, and Dr. Ferguson, I think, would be very good at speaking at that. But the idea of trying to maintain the rates as low as possible so that there isn't that much transmission. What we saw with Omicron is what we predicted from the standpoint of a very high transmissible virus in a situation where a lot of people are getting together and doing things, and you had this enormous spike that occurred. We are having the same kind of situation now, potentially with Mardi Gras, and if we're not careful, there could be some increases in there. And I think that most epidemiologists, most of the modeling I've seen has shown increases. So I think the first is to protect yourself, and by doing masking as well as vaccination boosting, looking at the people around you to see who is at risk and trying to protect them as much as possible. That may require you to be very careful or to keep them out of from situations where they would get infected. And then the general response to the community, that's kind of how I would layer it.
Okay. Dr. Hales, did you have something to add?
Yeah, let me just echo. I think we should go 3 for 3 here. I'm so grateful for the safety and efficacy of the vaccines that became available on a remarkably short time frame. Wonderful science supported that. In my career, I've at any point along the way, I would have just been so grateful for vaccines with that safety and efficacy profile. But they don't work if they don't go into arms. I give our city leadership, our mayor, our health director, others who've been spokespeople and advocates in this community for a much higher vaccination rate than the rest of the state, and certainly look across the South. New Orleans is somewhat of a model there, but we can do better. I'd love to see the vaccination rates higher in young people. The sort of common knowledge out there is that COVID is no big deal for young people. They certainly are at lower risk, but they're not at no risk. And we've seen at Children's Hospital some tragic outcomes and avoidable outcomes. So if you haven't been vaccinated and boosted, by all means do that. That is our path to the normality that we all crave. The other thing I'd mention, and I totally endorse the notion of measuring risk. Risk isn't a light switch. It's not all or nothing. Those who are very vulnerable need to be very careful. This is still a devastating disease for those who are at particular risk. We also have to acknowledge that all of our guidance and all the guidance of the experts who are watching these numbers and these outcomes so carefully, that guidance is being received in varying degrees by a population that's really exhausted by this pandemic. We just have to acknowledge that there is a weariness, and we want things to get back to normal. I worry about the loss of learning in our classrooms from so much interrupted study, and I want very much to see normality come back, and that's got much more to do with things like that than a Mardi Gras parade. We want our celebrations, and I think that the measures taken last year when all those events were canceled were appropriate to that time. This year, we're going forward with parades and with gatherings, with balls, and so on. And we simply need to approach that with a level of wisdom and care to protect those who are most vulnerable and to not put ourselves and others at additional risk.
Yeah, that's a great point. I'm wondering how that plays out on a parade route, for example. What are your recommendations, maybe especially for children? A lot of people want to take their kids to parades. What does that look like for kids?
I think what is very clear is that outdoors is better than indoors. If I look at the risk spectrum, the more crowded, the more indoors, the more poorly ventilated, the less masking going on, the more I worry about that. Outdoors on a parade route with the opportunity for a little distancing. As someone who really loves the art of Carnival and the beauty of lovely floats in a parade, this is a great year to take a few steps back and look at these things from a distance. I also I know we're talking mostly about the pandemic, but I'd be remiss if I didn't encourage parents to be so very careful of their children this time of year. There are many non-infectious disease risks at Carnival. I over and over again have had the panic call from a parent whose child has just toppled from a ladder. Trying to get to an emergency room on Mardi Gras is its own special challenge. But the risk of children scrambling under floats and the harms that can come, we're stretched in terms of our emergency response, in terms of our emergency rooms, in terms of ability to transport patients safely so it's a great year to double down on being very, very careful and safe, even beyond the risks of the coronavirus.
Yeah, and I think the point you make is that that brings up for me is that there are a lot of staff shortages right now, at hospitals, but also in our emergency response. EMS, I know, is kind of gearing up for this season, but they're still short what they would normally be at Mardi Gras. It's the story across the country in every industry, but I think it's especially concerning during Mardi Gras because we always see an increase, right, in the number of injuries due to accidents and intoxication. We have people in from out of town. Maybe Dr. Figueroa, can you tell us a little bit about hospital staffing right now and what you'd like people to keep in mind as we get into this really busy season for hospitals?
So as Dr. Hales pointed out, this is a dangerous time for children and for adults as well, and from the point of trauma and other sorts of things. And just the mere nature of Carnival, if you live on the parade route or near the parade route, gets to be really challenging in terms of transport and those sorts of things in a regular time. And so, as you pointed out, EMS is having personnel issues as other folks are having as well. I can tell you that the hospitals have been keeping employees, because one of the big concerns was during Omicron that we had a lot of employees out because they were sick. And so that they've gotten very good at sort of getting the employees back on duty in a safe fashion rapidly, and some of that was related to the CDC change of isolation protocol that was done in December. And so that's alleviated some of that. And then the reduction in terms of the numbers of cases has alleviated some of that as well. But that could recur for sure. And that could be a potential issue as well. So we don't need to have any more people in the hospital than are absolutely necessary, because we've got a lot of pent up demand for things that need to be done in a judicious manner, and so that being as safe as possible, both in terms of the virus, and I think Dr. Hales points out a very important aspect of just being safe in general. And this particular carnival season, I think, is going to be important for us to have a good.
Okay, lost part of you there, but I think I got what you're saying for the most part. Dr. Ferguson, I know you said you have 2 children, and we had conversations before about how you were deciding to go to Mardi Gras. What is your thinking there? And I'm also thinking about how a lot of the U.S. has access to at-home tests now, and how should people use those as far as attending events, and how should they make their choices about what is important for them to go to and what they might be good skipping?
Great question. And I agree with what's already been stated by other experts, Dr. Hale and Dr. Figueroa, in terms of thinking about, personal choices. So I don't necessarily want to echo, but it of course can echo in terms of us being safe throughout the season, but that there are personal choices as we, of how we choose to engage in kind of understanding our level of risk and those around us. If you're, often used to, large family gatherings, we've been through, these past 2 years of reducing the gathering, or figuring out if there's a grandmother or great aunt or someone that, does have, health compromises or has been sick, having the conversations or thinking about, should we be around them? But, even before that, the vaccination, the boosting status, and then of course what you bring up is the additional testing. Right, we don't necessarily, want to send everybody, because we can't necessarily handle the lines at all of our public places to go get tested, but there are availability of home testing kits, and being on with more knowledge helps us. I know it's been frustrated to hear kind of how the guidance has changed, but I asked the public and everybody to be patient, right, with the experts as we are, learning new things and getting into more knowledge, and the message might change some, but that home testing kits can be utilized well. I've been very impressed to hear about different crews requiring for different balls or different gatherings where they've required people to show vaccination status, as we've done in Orleans Parish in terms of some restaurants and bars, but showing vaccination status, and then also having a negative COVID test having to be shown to be a participant or to come to the larger gathering. So I do think that is a good thing, right, in terms of being able to on with knowledge. We do know that everybody, that we can still be positive and have had the vaccination and be boosted. A person can still become a case, and you can still transmit infection. So that's the part that makes us a little bit uneasy, but the more we know, the better and safer that we can be. I definitely agree with Dr. Hale in terms of, parade and parade route. We're outside, which will help us in terms of us being safe, but, still doing some of, thinking about mask coverage. I know we talked about that there's one question that we saw was postage about wearing your mask or N95s and face paint. One thing that I'll start to go, we don't necessarily know all of it, but in terms of the face paint, we consider in terms of being conscious about the seal around our face, right, in terms of how well the mask fits. So to me, that is still there and still a piece. We can have, a thin face paint and still have the mask fitting very well. We would question, because we have not necessarily done those experiments, thinking about, painting the mask itself, but you can have other coverages, right? So we've talked, and you've heard us talk about wear your N95 and then put your decorative mask on top, right? Oftentimes a great part about carnival season is that we are masked, right? That we have masks as part of our costume, and these are great costume. put the N95 under the costume to help protect yourself even more, or, incorporate into your, some of your children's outfit. And I know, that we talk about, if they're playing and all of that, that they might want to adjust their mask and do different things. That's expected. But then if you're going through different crowds, or as you move through larger crowds, do you mask up versus when a child is up on the ladder and having free and open space? So again, in terms of the different things in which we can do, hopefully, of course, hitting multiple topics or thinking about that in general. My children are teenagers, is the point you brought up in terms of my kids versus others. I do have niece and nephews, that's 1-year-olds and other. And in the past, when we've gotten together, we have done some additional testing, thinking about they can't be, or still, protecting them, or masking of others. So for me, we will do some parading, but then we will parade a little bit different. Something that Dr. Hale mentioned in terms of, kind of spacing or aware, doing some things at a distance, and maybe not being as, as many parades. But there is a personal choice and reflection, and kind of different choices of that you would make, along the parade route, and during the day and during the season. But I think we all can have a great time, and definitely appreciate this new normal. We keep wanting to, get back to where it was. It's really going to be a new normal for us. And I think we want to have a feeling. I think it's going to be a great booster for us as we think about the COVID vaccine booster, but it's going to be a booster for us in terms of our community to be able to engage again, to have some sense of social, to get away from some of the social isolation, because that has had an impact on adults and children and different things. So I think that there is a need for doing some of that, but of course, identifying how we can be the safest while we engage.
Yeah, that's a lot of great points there. And you're right that Mardi Gras is a time for masking, regardless of if it's after 2020. So I do want to talk about and Dr. Hales, did you have something you wanted to add?
No, just started that conversation about testing. And I think another role for that can be very effective. Again, I come back to those who are most vulnerable, most likely to be require hospitalization, end up in ICUs if they contract COVID. The many young people who are vaccinated and boosted will be they won't be as careful with the mask mandates and so on as we'd like. We have to acknowledge that, and we also know that most of the disease that would be contracted by vaccinated and boosted young healthy people is far less likely to be severe, may even be asymptomatic. So if I'm a young family and I go out and I have a wonderful Mardi Gras season, and then I think about going to visit grandparents or someone who is immunosuppressed, it's a wonderful time to take some days off and then test before taking those next steps. Our goal here is we can't reduce risks to zero. It cannot happen. It won't happen. But we can work carefully to protect the most vulnerable, and I think those kinds of strategies we need to embrace. It's been a huge problem that the approach to this pandemic has become politicized, and it's kind of detached from science and into emotion, and that has cost us a great deal, many lives, and just a great deal of suffering. So I'm hopeful that as we have these conversations, we acknowledge that risk will always be there, that the new normal accepts that, but minimizes it, particularly for the most vulnerable. That the path to that is immunizations and taking care to protect those who are at greatest risk for bad outcomes from this virus.
Yeah, you make a lot of great points, and just the reality that yes, we have a mask mandate here, but I often might walk into somewhere and see a lot of people, not wearing masks. And I want to talk about a time kind of when masks do come off, which is crew balls potentially. So how can crews kind of minimize that risk? Is there something with ventilation they can do? Is, if you're walking into a ball and you see no one is masked, like what should your thinking be along those lines? What thoughts do you have there, Dr. Hales?
I'll go briefly first, and then I'm going to hand that one to Dr. Ferguson and Dr. Figueroa.
Okay.
Because there is a disconnect. We have to be honest about that. We have all been in places, even where the mask mandate has been acknowledged, that it's been ignored. And in fact, if we're in an eating establishment, for example, while eating and drinking, masks come off, and some of those establishments can be very crowded. So this is a reality, and it is a matter of counting that risk and managing that, and not layering risk to a point where that becomes unacceptable. I'm glad that the at least the balls that I have seen are being officials are being very, very direct and about insisting on proof of vaccination or a negative test. There certainly is an endorsement. No one is saying go ahead and ignore the mask mandate, but I think that that particularly those at greatest risk have to simply be extraordinarily careful, and it may be the wrong year to attend a gathering where many are going to be unmasked.
Yeah. Dr. Figueroa, any thoughts about how crews can make this a safer time? Because often, at parties or, even bars, masks are going to come off. People feel like we're returning to a pre-COVID era.
Yeah, so I think the issue of testing you brought up earlier, Dr. Ferguson and Dr. Hales both talked about it, is really important. So if you're going to be in those situations, to try to minimize your ability to transmit to other people. So you test yourself so that you make sure that when you're in that situation that you're not going to be transmitting to other individuals. And then at some point after those kinds of big events, you might want to also test yourself to kind of see what's going on with that. Because if you have a high risk exposure, what we do in the hospital setting and in the school setting is that usually we do testing after those kinds of things. So I think I would recommend both of those things to try to minimize the amount of spread that would be happening in those situations. The other things are sort of environmental controls. So as much outside as possible, as much ventilation as possible. The biggest space, the bigger the space, the better, things are going to be. So really taking advantage of those sorts of things. So my sort of nightmare scenario is small place, lots of people packed in, and very poor ventilation, and everybody is drinking. So those situations exist around the city. And I think that those of us who are a little bit more concerned about getting COVID should take that into consideration when we're making our own plans. And then I would imagine that the Carnival crews want to make sure that they protect as many people as possible through those measures as was mentioned.
Gotcha. Yeah, so it comes back to just that kind of individualized approach to, do I want to put myself in that situation? Okay. I have another question for you, Dr. Figueroa. When we think about Mardi Gras, we're of course thinking about the super spreader event of 2020, when it's been shown that it possibly seeded infections kind of across the South and kind of kicked off infections for a good amount of people. How do you think about the risk of more variants from a gathering like this, where you have people coming in from other places? Like, is that something on your mind? Is that something we should be concerned about? I know I hate to even bring that word up, but yeah, how do you think about that risk?
Well, so Mardi Gras is a time when people from all over the world come to New Orleans to be with us. And so therefore, variants that are out there have an opportunity to potentially spread in the environments that we just been discussing. So at the moment, we've sort of had Omicron, and that's the big variant that's been around. There's the BA2 variant, which is similar to Omicron, but a little bit different. It seems as if there is protection with the vaccines as well as with previous Omicron infection for the BA2 infection. I will remind everyone that at the moment, certain areas in Europe are having lots of problems with BA2. And so therefore, just to just because Omicron's gone doesn't mean that we're not going to have other variants. In terms of other variants that we don't know about yet, I mean, that's obviously potential risk as well, although we haven't heard about anything. At least WHO hasn't announced anything, or CDC hasn't announced anything. But I think that in general, the stance should be that if you're a vulnerable individual, or if you have people in your circle that are vulnerable, then you should try to mitigate the risk as much as possible. And so that's the vaccination, the masking, as well as the testing. I think that would be my recommendation. But people are going to come to New Orleans. They're going to have a good time, and they're going to go back. And so that anyone who's listening to this, who's coming to New Orleans, I would also recommend getting tested when you go back to your place. Make sure that you haven't contracted the virus, and then can transmit it to your populations in your local community.
Yeah, I think, the idea that you should lay low after Mardi Gras or get tested is a really good point.
Yeah, I think you got to assume that unless, if you stay outside and your distance and all that, I think, you're probably in pretty good shape for the most part. I mean, there have been outbreaks of Omicron in outdoor activities and things. But usually people are packed in, very close together, no masking, they're drinking and eating and doing all those sorts of things. So if you're somewhat careful, I think you can be fine. The issue is when you go into large spaces with a lot of people who are unmasked, and particularly if you're doing a lot of drinking and eating and things like that. So in our restaurants and things like that, those are potentially high-risk situations, in which case then I would assume that you are potentially exposed as you go back. And as you're sort of implying, I would definitely get tested. And then the question is whether you lay low for a little while, work from remotely or whatever it is that you can do until you get tested and then they get cleared. I think that would be a reasonable recommendation for all our visitors.
Emily, I'm looking forward to what happens after Mardi Gras. I mean, after all the craziness, you get Ash Wednesday and everybody gives everything up, right? But what I'm looking forward to there is something that might start to look a little bit like the last period of time in New Orleans that felt sort of normal, and that was before the Omicron surge, when our case positivity rate dropped, down to 2 or 3%, something like that. And I mean, the greatest protection we can have as a community is first to be immunized and boosted, but second, to have very low levels of circulating virus. I mean, that gets you to sort of normal, right? And we had a stretch there where it was feeling really good. And of course, Omicron came along and changed that totally. Our statistics in New Orleans are really quite favorable, and the curves are going in the right direction. We are going to bring a whole bunch of visitors in. I mean, that's one of the reasons Rex was founded, was to invite the whole world to come, and they still come, and they bring stuff with them and they take stuff away. And when after all the celebrations, we'll go back to looking at our dashboards and hopefully seeing our case positivity rate continue to fall. The numbers presenting to emergency rooms and hospitals needing care for COVID dropping, immunization rates going up. And at that point, I would expect some of the mandates that to be modified. I'm really pleased to see some of the approaches to school children and how classes are quarantined or isolated, to see those modified a bit to reflect the realities that are in place now. Again, we've lost a year of learning or more in particularly in our most disadvantaged students. We really need to be able to get back to that point where schools are in session, in person, day after day, week after week, to accomplish what needs to be accomplished there and to do it safely. So the other side of Mardi Gras, when we've all celebrated and we've all tested and we're negative and we're all getting back, I hope our case positivity rate is even lower than it is now, and it will allow us to resume what will feel a bit more like a sustainable normal.
Yeah, I think what your comments bring up for me is that it's sometimes hard to feel like we've made progress, right? Because we keep going in these waves, and it keeps happening, right? And every time we think, is this it? Is it over now? So Dr. Ferguson, I'd love to hear from you. We're, coming off of our 5th wave now. Like, will there be another one? Like, what does this really look like? Can anyone say?
Right. Well, of course, we don't have a crystal ball. We do look at, modeling and trajectories, and we look at what's going on globally. And, for the most part, we do feel like, it is cyclic in nature, and there will be another wave, especially, post, all of the influx into the city. That's, we were, placing bets, we would, think that there would be an increase, and we're pretty confident that we're going to see an increase to where we want to go. And what, Dr. Hale is definitely mentioning, all of that is, correct, and what we want to see. And we are looking forward to when they can go back down. So we do feel, and educated guests and looking at modeling that there will be an increase, but then thinking hopefully we can get through that surge quicker. So we can get the case rates back down, so we can get that infectivity rate back down. But of course, we will potentially see, yes, more variants, but we don't necessarily, know into what effect it will impact our communities. But with all of the people coming in, with the change and with the celebration, it shouldn't be a surprise for most people to think that there will be a change in the rates. This downward, trend that we're on now will be impacted, but we're looking and are definitely hopeful that we, with all the things that we have in the mitigation procedures, with the vaccination rates, that it won't last as long, that we can get through it quicker, that we can still have more preservation of life, that there be less critically ill individuals as we move through it. So that is our hope, and we definitely think that is a possibility.
Yeah. And to Dr. Hale's point, like, we are making progress, even though it feels like sometimes we're back in this again, that, we know how to approach treatment better. We have a lot more tools. Dr. Figueroa, did you want to add to that?
Yeah, I want to sort of piggyback on that from the standpoint of things are much better now than they were 2 years ago, or right before we started this adventure in March. Of 2020. Our therapeutics are better, our diagnostics are better, our ability to have less impactful disease is better because of the vaccination and because of monoclonal antibodies and all kinds of things that are available now that we didn't have 2 years ago. And if you look at Omicron, we had a huge spike in cases. But our hospitalization rate, although it did go up for sure, was not quite as high as what we saw in Delta, which was in the summer. And the death rates and the hospitalization rates by ratio with the number of cases was a lot higher with Delta. So we're making progress. There's no doubt about that. The thing I think that we're all trying to emphasize is to be as safe as possible so that we continue to make that progress. And then hopefully get to a point where there's going to be probably cyclical outbreaks of COVID, much like influenza and the other sorts of respiratory viruses that we see. And hopefully we will have, there will be a vulnerable population that will be affected. I don't think we're going to get away from that. But I think that we have better therapeutics, we have better ways of preventing things, and we understand the virus so much better now than what we did 2 years ago, that we will get to a point where Dr. Hales mentioned the new normal will be really kind of at that point.
Yeah. All right. Well, we did take some questions from the audience. I think we've answered most of them. So I'll just ask if there's any kind of final thoughts about most of the questions were, should I go to X parade? What is my risk if I'm vaccinated, but other people aren't? Should I go indoors then after the parade? And I think we've kind of gone over how to think about that. But does anyone have any final thoughts about that and Mardi Gras and what comes after?
Emily just returned to one thing, not so much about risk, but I just have to say again how wonderfully devoted and skillful our healthcare providers have been. In the early phases, when our hospitals were overwhelmed, our ICUs were overwhelmed, we didn't have the therapeutic tools that we have now. But I just saw real heroes going into those ICUs, into those hospitals every day. Some of the work done in our hospitals, I'm thinking particularly of University Medical Center, really pioneering techniques for treating the sickest COVID patients that were rolled out regionally and nationally and internationally. As I watched those statistics and recognizing the human stories behind them, one of the most powerful experiences I've had in my years in medicine. And I will forever be grateful to those physicians, nurses, respiratory technicians, and others. It's been a different challenge during the Omicron surge. Not so many patients reaching the ICU, better treatments available, but because of the communicability of that strain, just a huge challenge keeping hospitals staffed. So when I against that backdrop, I think it's simply another argument as we move into this season and we come together and we celebrate and we renew rhythms that are part of our culture, part of who we are in this city, that we do so as safely as possible, not just in terms of COVID, but in terms of being wise and careful in other decisions. This just isn't a time to expect to have an ambulance roll up in 5 minutes if you've done something really dumb. And so what I encourage, although revelry and Mardi Gras are never about being temperate, at least historically, this is a year that I would very much advocate for that. Enjoy the beauty of it, enjoy coming together safely, enjoy the renewal of those traditions. But let's be wise in how we celebrate so that we can have happier years in the future.
Dr. Ferguson, did you want to add something?
Sure. Just the same sentiments as Dr. Hale has eloquently stated. Thinking about, of course, enjoying the season, enjoying where we are. Definitely hats off to our heroes in the healthcare setting. All of our nurses and doctors who have definitely forged ahead and been the frontline workers on many different capacities throughout the pandemic and who still are. And of course, thank the public and everyone for doing their part in helping with the fight. As we talk about our individual risks, but then also thinking about and being considerate of our family members, but definitely our neighbors and our community. I think we're all here wanting to definitely support our community in being able to have the safest Mardi Gras we can, or having a safe 2022 Mardi Gras in spite of COVID. So hopefully everybody's hearing that we're not, of course, painting any gloom and doom, but a celebratory time and wishing everybody well, hoping that we can socialize and see smiling faces and still protect ourselves and protect others and loved ones after we've gone out and had this fun and as we go back into to regular lives, but wanting to keep this going, wanting to keep our schools open, keep our classrooms populated, keep our children safe. And of course, keep us out of the emergency room. Of course, being a public health person, we often think about, the health of everybody overall. So thinking about, those healthy behaviors and us making wise choices. So the things that Dr. Hale and Dr. Figueroa that we pointed out before, being safe on the route, being conscious of our environment, as people, pointed out, and thinking about community members in terms of, different crime, that people know that this is a tourist time, and sometimes we have our guards let down. So of course, being mindful of where your children are, where your family members are. If you're coming in groups, staying together. Ensuring in terms of we don't want any pickpocketers or anything being vulnerable or succumbing to any other kind of situations. But of course, being careful when we're crossing the streets in terms of Carnival, because we don't want you needing that additional medical assistance during that time. So we're not still overwhelming, or we can't get to you, or individuals or the healthcare teams cannot get to you, because of course we know that Endymion night is one of the highest rates of ER that happens in the city of New Orleans. One of our biggest nights and fabulous times, and of course during the season. But we want the fund to be able to continue, and we want our rates to continue to go down. So we understand and definitely encourage it.
Gotcha. Thank you. And Dr. Figueroa, any final thoughts?
The only thing I would say, echoing everything that's been said before, is definitely have a good time, have a safe time. But this is also the first of other celebrations. So if Mardi Gras, we're going to learn from Mardi Gras, and I think that will be rolled into Jazz Fest and French Quarter Fest and all the other things that make New Orleans, New Orleans, and we are all dying to do that. In a big way, but we want to do it in such a way that we can continue to enjoy those things. And so again, I totally agree with everything that's been said before. Try to be as safe as possible. Enjoy the time. I sort of think about the time after Katrina, when the locals began to really kind of appreciate what Mardi Gras was like, what Jazz Fest was like, all these things. I mean, I think to Dr. Hales' point, this is the time to kind of really enjoy why we live in this city, enjoy the parades, enjoy the beauty of everything that's going on, and do it safely.
Great. Well, thank you all so much. I know this conversation has given me a lot to think about. It's, made me really excited actually for what's coming. And I'm just glad that we can share that with everyone else. So I appreciate your time and your insight. Thank you.